Hello, this is me, Tina Thomas from IILT, and I have Richa with me. So today we are going to do a role play on pediatric department. So you're going to see a 5-year-old girl with her mom. She's having a problem with her adenoid gland and something called as adenoiditis. So we'll see how this role play is going to go, and we'll see how Richa is going to take the role as an interlocutor and I'm going to take the role as a nurse, and we'll see how the role play is going to start. Okay?
Right. Yeah.
Yes.
So your 3 minutes is up.
Okay.
Let's start.
Oh, yes.
Yeah.
Good morning.
Morning.
My name is Tina Thomas and I'm the registered nurse working in this pediatric department. How may I help you today?
Hi there. So my name is Richa and I'm here with my 5-year-old daughter. Her name is Thea.
Thea?
So she's facing a couple of difficulties recently and I'm really worried about it. So could you please look into it?
Definitely, and I'm here to help you out. So you were telling me that your daughter's name is Thea and she's 5 years old. Just for confirmation, I just asked. Okay, so you told me that your daughter is having some problems, right? Could you please tell me in detail what is she experiencing?
Well, it started with breathing difficulty. So initially it was not very intense, but gradually it progressed to be uncontrollable.
Okay.
And at night she's not able to sleep properly. She's kind of like having this snoring problem. And when I notice at night, she kind of like sleeps with her mouth wide open. Since she's having the breathing difficulty, she's having interrupted sleeping pattern too.
Okay.
And sometimes she complains about having pain and unable to swallow food. So these are the difficulties she's experiencing right now.
Okay, so what I understood from you is that your daughter is having breathing difficulty. Initially it was fine, but gradually it started to worsen.
Yeah.
And then she's having sleep disturbance because of the snoring, and she's opening her mouth wide open while she's sleeping. Yes?
That's right, yeah.
Okay, is there anything else that you would like to add on to it?
No, besides this, that's
yes.
all. Yeah.
Okay, so if you don't mind, may I just examine your daughter so that I can just find out what could be the major cause for it?
Yeah, sure.
Yes?
Go ahead, please.
Okay, so, well, Richa, what Thea is having is adenoiditis. Do you know what adenoiditis is?
Well, it's the first time I'm hearing such a thing.
Okay, so what adenoiditis means, inside our nose, there is a small gland, okay? And this gland gets infected, maybe due to some bacterial infection, or maybe even can be due to some allergies, okay? So this is the one cause what your daughter is having that has caused her to have all these signs and symptoms. Yes, and there are a lot of treatments for that. Nothing to worry about it. There are a lot of simple procedures and treatments what we can do for your daughter. May I tell you that?
Yes.
Yes. So the first treatment, the first best treatment what we can do for that is adenoidectomy. That is, we're going to remove this adenoid. How does that sound for you?
You mean a surgical removal?
Yes.
Well, that sounds a little odd to me because she's just 5 years old and I don't think it's really a good age or, it's not a good idea to put her under blade. So do you have any other alternatives other than surgery?
Actually, Richa, we do have alternates, but it's just medicines, but doesn't give it a full, cure for your daughter's underlying problem. As she's experiencing so much of problem, and as you said, she's opening her mouth and sleeping, sometimes even she can choke. We won't know because we go in for a deep sleep. We will not know what our daughter is experiencing, right?
Yeah.
So that's one major thing. And 5 years is the apt age for doing the surgery. And you know what? The surgery just takes 30 minutes, less than 30 minutes. And that day itself, you can go back home. Just think, the thing is that you need to take care of your daughter for the first 2 weeks initially so that you will not have any visitors coming. The small problems she'll be having. Other than that, this is actually a very good treatment for your daughter. How does that sound?
Well, sounds very worrying for me, but still, if that's the only way we can remove this, then yes, we have to go for it then, I guess.
Okay, but I would like to tell you more about it, so that, you will get a better idea about what the surgery is. May I?
That would be good, yeah.
Okay, so actually the surgery is a very simple surgery, and as I said earlier, it just takes 30 minutes, okay? Within 30 minutes, the surgery is done, and it has been done by an ENT surgeon, okay? So it's not any other surgeons, it's an ears, nose, throat surgeon who's going to do that, and we have a surgeon over here. Okay, and there are certain things that you need to look into aftercare, that is post-surgery. May I tell you about those?
Yeah, please.
You would like to know about
Yes,
it, right?
yes, I would.
Yes. So as I said, 1 to 2 weeks is the time for your daughter to recover. So that's a healing time. So first thing that we need to do is we should avoid a lot of visitors coming to our home, because visitors are the most people who are prone to carry infections, right? So see that you don't have that. And then the second thing is you can come the same day to your home itself, because after the surgery you can come back home the same day. You don't need to stay in the hospital. Then regarding the food, what you can give to your daughter, because it's a surgery which has been done, so it has been connected to your nose as well as through the mouth, so your daughter will be having some problem with swallowing. So what we can do about this, you can give her light fluids or semi-solid fluids. Is that okay?
Yeah, sounds all right to me.
And then avoid giving her citrus fruits, because it can cause an irritation in her throat. Okay, you know citrus fruits, right?
Yes,
lemon, oranges, even juices, citrus juices. So please see that you don't give all those. And then do not give anything that is hot, because it can cause bleeding. Yes?
Yeah.
Okay?
Yeah, I understand.
Yes. And then there might be some other post symptoms your daughter can face after the surgery. It is normal. It is minor, and you don't need to get panicked about it, or you don't need to get worried about it. It is usual. For any people who undergo a surgery, they experience small problems. The first problem is pain. For that, we give them pain medicines, and maybe she'll be having a little difficulty in swallowing. That also, that's what I said, like we can use some solids, semi-solids, or like liquid diets, so that your daughter will not have that problem. Yes?
Yeah.
Yes. Would you like to ask me anything more?
No, that's all. So I think you can talk to the doctor and make arrangements for the surgery.
Definitely, I will talk to the doctor and I'll make all the arrangements, and I will see you shortly. Okay?
All right. Thank you very much. So by this, we have come to the end of this discussion. I hope you guys have enjoyed it, and we'll have a brief discussion about how we can do this role play in a better way, kind of like a feedback form. So we will get into that. So thank you so much for watching. So right now, you watched a video where a concerned parent is talking to the nurse. And now we can discuss a cue card with how to create sentences for each task. So, whenever we do a role play for a concerned mother, we have to provide a lot of emotional support and connect emotionally with the person, because they are having high emotions there, because they're talking about a small child, and especially in this case, it is a 5-year-old one. So let's see how we can do it. So here the first task says, begin with warm greetings and inquire the purpose of her visit. So we are just basically starting with the warm greeting. So that is our first keyword. And then second keyword is to inquire about the reason for the visit. So starting with warm greetings, as you always do, you can just start by randomly saying, good morning, my name is, and you can introduce yourself, and then you can just wish them. And continuation of that, you can ask, may I know the reason for your visit? Or in these cases, when you see a person or a mother standing in front of you along with a child, you can ask in a different way too. You can relate to that directly. You can say, so after introducing yourself, you can say, I can see that you brought your child along with you. What can I do for you? So that's a different way of doing it, because you do not have to always stick on to this strategic way or the traditional conventional way of speaking, because we do not have a particular script. If you want to relate emotionally to that particular context, you can do that. You're free to do that. So either you can go with the direct structure of the role play, or you can use a different way of emotional approach as well. So that's the first one. The second task, ask for the symptoms experienced. So here simple, the keyword is symptoms. So you can simply ask, what are the symptoms she experiences? The third one, examine the child and inform the parent that the findings show an inflamed adenoid. So here, the first part of this the task is to examine the child. And after that, you're actually explaining what you found from the examination. So when you ask for the examination, the permission for examination, you can say something like, I understand you're really worried about your daughter at the moment, but don't worry, let me examine her. Or with your permission, can I examine her? And after that, you're pausing for 1 second and you're saying, based on my examination, I can see that she is having an inflamed adenoid. Because in the second half, the keyword can be inflamed adenoid, because that is the information which we are conveying to the mother. So that's the second task. That's the third task. The fourth one, when asked, explain it is the inflammation on the adenoids due to the infection, in brackets, bacterial or allergy. So here the keywords are inflammation on the adenoids, infection, which is bacterial or allergic. So you just need to make sure these words are there in the sentence which you're creating. So you can say, I understand as a mother you're really worried to know that your daughter is unwell, but don't worry, she's going through a medical condition which can be controlled and treated with proper medication and care. This is just an acknowledgement. You can go for the acknowledgements which you are comfortable with. You do not have to give a very lengthy acknowledgement there. If you want to, you can just paraphrase the information or the emotional context of the mother there and relate to the mother there emotionally. And after that, you can come to the task explanation. You can say, I'll explain what is the condition of your daughter. So it is an inflammation on the adenoids. And if you want, you can explain what is an adenoid as well, because a common person or a layman won't be able to understand the technical terms. And also, it is very important that you don't use a lot of technical terms in the role play as well. So you can explain what it is, and then you can say, there's nothing to be worried about. It is just because of an infection, maybe bacterial or allergic. So just make sure you are including the keywords, which are the important idea the patient should convey, or the patient or the bystander should understand. So that is the fourth one. Fifth task, reassure the patient it is manageable by a procedure called adenoidectomy. Surgical removal, simple procedure, 30 minutes maximum, performed by an ENT surgeon. So here, just in the bracket itself, we are having a lot of information to convey. So make sure that whatever information is given in the cue cards are conveyed, because those are also relevant information the bystander or the patient should know. So here, if we jot down the keywords, we have to mention it is manageable by a surgical procedure and the name of the procedure. You have to mention it's a simple one, the time, which is 30 minutes, and who is going to perform it. So now let's look into the sentence. As a concerned parent, I can sense that you're really worried. However, let me assure you that it is manageable by a simple procedure called adenoidectomy. In this procedure, we will surgically remove the inflamed adenoid. Do not worry, it is very simple and it will not be prolonged more than 30 minutes. And it will be performed by a specialized ENT surgeon as well. And after you finish this explanation, you can just confirm by asking a short question whether she understood or whether she is willing for the procedure. That is the fifth one. Now, if you look into the sixth task, explain the aftercare. Recovery 1 to 2 weeks, can go home same day, give soft foods, avoid high levels of citrics, hot beverages. So here also, like the previous task, we have a lot of information which we are supposed to convey in the bracket. So we are especially talking about the aftercare here. So yeah, obviously the keyword will be aftercare. And after that, we have to mention about the recovery period, which is 1 to 2 weeks. And we have to especially state when the patient can go home, and about aftercare, like the food she can eat, the food she should avoid. So let's look into the sentence. Right now, I would like to explain about how to take care of your child after the surgery. She will be recovered within 1 to 2 weeks of time. Just make sure that she gets proper rest. And also, you can go home the same day of the surgery. You do not have to stay here in the hospital. Just please make sure that as she underwent the surgery, make sure to give her soft food and avoid high levels of citrics, which might cause uneasiness. And then you have to also mention about hot beverages, and you can explain what are the hot beverages. Hot beverages like coffee or hot milk or anything like that. So we'll have a look into the sentence once again. You can say, I would like to explain about how to look after your daughter after the surgery. So it will take approximately 1 to 2 weeks for her to recover, and she can go home on the same day of the surgery. Please make sure to give her soft foods and avoid high levels of citrics. And also make sure that she is not given any hot beverages like hot coffee, tea, or hot milk. So that is the sixth one. Now the last task. Inform the parent the child might experience common post-surgery symptoms, but not to be worried. What are the keywords here? So here we can see the keywords as experience common post-surgery symptoms. But here the post-surgery symptoms are not mentioned in the cue card. But if you know the common post-surgery symptoms, you can definitely convey that. Because when you're just saying that she might experience post-surgical symptoms, we will be worried, or from the parent's side, she will be worried about what it can be. But if you know the few mild symptoms she might experience, you can definitely say that. So here the keywords are post-surgery symptoms. So when we create a sentence including these keywords, it will be like, I would also like to inform you that your daughter might experience some mild post-surgical symptoms such as pain, difficulty in swallowing, etc. But don't worry, in case of any severity, you can always approach the hospital. That is an addition I gave her because that is an assurance. Because here in the statement, I'm actually telling that she might experience some symptoms, which is not a very happy news, right? But when I give that assurance, I'm also telling her in case if she has some of the symptoms, she can always come to the hospital. We are there to help her. So that additional assurance that you provide when you're giving a news which is not a very happy news to the patient is always a better way to correlate. It will have a connection and you're providing that emotional support there. Okay, so that is a sentence there. So these are the different ways of creating sentences using the keywords in this particular role play. I hope this was helpful for you guys. If yes, please do mention in the comment box. And if at all you have any suggestions, always feel free to let us know. We'll look into it. So thank you so much. See you next time.
IILT, it's my cup of tea.